Okay, so we're going to have a look at CSF flow and learn a bit of anatomy from a T1 weighted MRI of a 2-year-old. So, the CSF is produced by the choroid plexus, seen in the lateral third and fourth ventricles. Daily, around 600 ml of CSF is produced. The volume of CSF in circulation averages around 150 to 250 ml. It is drained via the arachnoid granulations and the dural venous sinuses. The flow direction of the ventricular system, it begins in the lateral ventricles, then through the interventricular foramen of Monro, exits into the third ventricle. Through the aqueduct of Sylvius, it exits into the fourth ventricle. There are two outflow tracts from the fourth ventricle, the median Megendie tract and the lateral Lushka tract. So the L for L, M for M. From the fourth ventricle, they exit into the cisterna magna, and from the cisterna magna into the subarachnoid space. The arachnoid granulations absorb them and they pass on into the dural venous sinuses. So what does the CSF do? So it's basically a shock absorber for the brain and the spinal cord. It helps in removing metabolic waste. It transports neuromodulators and neurotransmitters and can be sampled using lumbar puncture. All right. So now let's have a look at this is a T1 weighted volumetric imaging of the brain. We're going to T1 is a very good sequence for identifying anatomy. Fluid is actually dark in T1, but I just want to use this sequence to demonstrate the anatomy. So let's have a look at the coronal plane. So as you can see, this is the orbits. So you can see the globes, eye globes on both sides. So these would be the frontal lobes. So as I move posteriorly, you can see the beginning of the frontal horns of the lateral ventricle. As you progress towards the body of both the lateral ventricles, you can see there is a demonstrable outflow tract from the lateral ventricles exiting into the third ventricle. So this is the interventricular foramen of Monro. On both sides, as you can see, they drain into the third ventricle. So as you can see here, this is the midline structure, which is the third ventricle. And as I go posteriorly, you can see there is an outflow tract from the third ventricle. This is the aqueduct of Sylvius, which drains into the fourth ventricle, which is like a quadrangular pyramidal structure. So as you can see, from the fourth ventricle, you can see there are two lateral apertures, L for Lushka, from which the CSF drains into the cisterna magna and the cerebellopontine cisterns. So that's in the coronal plane. Now, if I were to demonstrate it in the axial plane, as you can see, when I come from a craniocaudal view, here you can clearly see the frontal horns of the lateral ventricles, the body of the lateral ventricles. Inside you can identify the choroid plexus. As you can see, the trigone and the atrium of the lateral ventricles, the projection towards the posterior horn or the occipital horns. All right. And as I come down, you can see them through the interventricular foramen of Monro, draining into the third ventricle, and posteriorly you can see the aqueduct of Sylvius, through which we open up into the fourth ventricle. From the fourth ventricle, you can see the two lateral outflow tracts, Lushka, and the median tract, Megendie. They all go down into the cerebellopontine cistern as well as the cisterna magna. From there, they exit into the subarachnoid space, and via the arachnoid granulations, they are absorbed by the dural venous sinuses. Alright, so this is a basic anatomy. Again, I can demonstrate it to you in the sagittal view. So as you can see here, this would be a nice midline section. So as you can see here, if you see here, these are the lateral ventricles. And as you can see, the lateral ventricles to the interventricular foramen of Monro drains into the third ventricle. So this is the third ventricle, as you can see. And posteriorly and inferiorly, you have the aqueduct of Sylvius, which drains into the fourth ventricle. And from the fourth ventricle, you can see the outflow tracts, the midline, which is the magenta, and the lateral outflow tracts, Lishka tracts on either side, draining into the cisterna magna and the cerebellopontine cisterns, wherein it is absorbed into the arachnoid granulations and drained by the durovenous sinuses.